Running the front desk of a dental practice today is one of the hardest jobs in healthcare administration. You are fielding calls, verifying insurance, and checking patients in, often all at the same time. Right now, 42% of dental practices report dealing with administrative backlogs every single week. The job has grown from simple scheduling and patient greeting into managing dental billing codes, prior authorizations, and complex payer workflows. This line graph tracks the weekly hours practices spend on insurance administration. In 2019, the average was 8.1 hours. Today, that has climbed to 12.3 hours per week. That is a 52% increase in insurance admin in just 6 years. When you ask a small in-house team to shoulder that kind of expanding workload, the system fractures. The daily friction burns out staff and ultimately drives them to look for work elsewhere. Every year, between 17 and 25% of dental team members leave their jobs. Most practice owners look at a $35,000 average base salary and assume that is what an administrative hire costs. But the base salary is just the starting line. On top of base salary, you add thousands for benefits, payroll taxes, onboarding, equipment, and time off. The fully loaded annual cost for a single in-house administrative hire sits at approximately $60,800. And when that person leaves, the gap in coverage hurts. Factoring in lost productivity, training time, and service degradation, replacing a single dental receptionist can cost a practice up to $70,000. Hiring, training, and losing staff over and over is an active drain on the bottom line. The traditional local hiring model is breaking down under its own weight. To fix this, more than 800 practices across all 50 states have moved away from local hiring. They are instead utilizing Staffingly's dedicated dental virtual assistants. Staffingly provides a dedicated team of offshore professionals specializing in U.S. healthcare terminology and dental administration. We see the security architecture here. All patient data runs through a strict enterprise-grade environment, maintaining full HIPAA, SOC 2, and HITrust compliance. Through secure bidirectional integration, the virtual assistant connects directly into your existing electronic health record system, working exactly like an in-house employee. You do not need a team member sitting in the waiting room to handle insurance verification or claim denials. Premium administrative work happens securely through integrated remote workflows. Staffingly pairs this dedicated human team with a proprietary layer of AI automation to handle repetitive dental administration. Look at how the routing works. As dental items enter the system, an auto-categorization feature instantly classifies them by type, urgency, and action required. The platform then automatically balances that workload across the virtual team. Tasks shift dynamically so no single person becomes a bottleneck. Behind the scenes, automated compliance monitoring runs continuous regulatory checks on all processing, maintaining 99% task accuracy while keeping audit risks low. You get a trained specialist backed by continuous machine triage. A solo hire at the front desk simply cannot replicate the efficiency of a scalable administrative machine. Let's run the numbers on what happens to your bottom line when you switch to this model. A dedicated Staffingly virtual assistant starts at a flat rate of $1,800 per month. That single number completely absorbs the costs of benefits, payroll taxes, training, and management overhead. Here are the annual costs. On the left, the $60,000 cost of an in-house hire versus the $21,000 virtual alternative. That gap represents a 64% cost reduction. You save $39,200 for a single administrative position every single year. Trimming the budget by a few percentage points is helpful, but removing $39,000 in overhead per employee permanently ends the financial strain of the staffing spiral. Deployment is fast. A practice can go live within 48 to 72 hours, with the team fully onboarded and ramped up to maximum task volume in just 14 days. There are no long-term contracts locking you in, and you can test the entire workflow right now with a 2-week risk-free pilot at no cost. Stop funding the hidden costs of constant turnover. Hundreds of modern clinics are already using this model to stabilize their operations and protect their margins. The data proves that dedicated outsourcing works. The only remaining question is how much longer the in-house approach is worth the cost.